Welcome to the SportsFit Mum podcast, the place for expert knowledge and advice for your pregnancy and post-baby health and fitness journey. If we haven't met before, I'm Marnie, mum of two, health and fitness coach, international athlete and founder of the SportsFit Mum community. Join us each and every week for lots of motivation and inspirational stories for you, the sport-playing, exercising, loving mum or mum. Hi everybody, welcome to another episode of the Sports Fit Mums podcast. I'm super excited today. We have another guest, and our guest is Carolyn from the Caesarean Birth Specialist. She specialises in inclusive training and support in caesarean births for birth workers and parents-to-be. I'm super excited to be chatting all about what are caesarean births, how to prepare for caesarean births, all the stats related to caesarean births with an expert. Carolyn, welcome to the podcast.
Hi, thank you for having me. I'm really excited.
So if you can hear, Carolyn is from Scotland.
I am.
We just spoke about how grey and dingy it is up there at the moment. And, you know, my response was, nothing's changed.
I know everybody always thinks it's grey and dingy. Nobody ever sees the really nice sunny days we get. We do get them, I promise.
Well, my partner is from Scotland, and when I first met him, we were up in Edinburgh quite a lot. His parents lived in Perth, just outside of Edinburgh. And I think out of the quite a few times that I was up there was probably only 1 or 2 sunny days, to be fair, Carolyn.
Yeah, it just comes, we get like 4 or 5 in a row, and then that's it for summer. Yeah.
The only thing I remember is in summertime being like, I don't know, 10:30 at night, and it's still light.
Yeah, it's lovely.
But it's freezing, so what's the point? Anyway, I would love to know, and I know the listeners would love to know as well, the Caesarean Birth Specialist. Tell us about your journey here and why you do what you do.
Okay, great question. So I did my midwifery training a few years ago. Worked, obviously did placements as a student on the wards, community. And part of that obviously is spending time in theatre during caesarean births, supporting in there as well. When I qualified, I decided to go and work as a doula instead, because I felt like I could make more of a difference to people's birth experiences working outside of the NHS. So I went and did my doula training, started working as a generic doula. I don't know if there's such a thing because we're all very different, but because of my midwifery background, I kept finding that I was attracting clients who were traditionally labelled, which I hate labelling, but high risk. So a lot of them tended to end up with caesarean births. And initially, as a doula, I was like, oh no, I'm failing. I'm doing something really wrong. And my clients are ending up with a caesarean. And it was only after a chat with my mentor, actually. And she said, no, you're just the person that they needed all along. I thought, oh, and that really resonated. And I kind of sat on it for a while and realised that actually a lot of doulas and birth workers, unless they've experienced a caesarean birth themselves, don't necessarily have that knowledge, because as doulas, we're not usually allowed in to support clients in theatre. I know, I think they think we're going to run around touching all the sterile drapes and things. I don't know what they're expecting. So they tend to only be in if the birth partner, the other birth partner they have isn't going in. So it's not very common. So I thought, you know what, like, more people need this knowledge. So I've started running courses for birth workers and for parents-to-be, just talking more about caesarean birth, normalising it a bit more, making it more positive, because that's definitely really important as well. So I just want everybody to be able to have a really positive caesarean birth, regardless of whether it's planned or not.
Yeah, I love that, because that's, you know, one of the reasons, you know, I wanted to connect is because, you know, you said your mission is to make sure that everybody has a positive experience. Like you said, whether it's planned or not planned. And there's so much stigma around caesarean birth, in my opinion. And, you know, I have to confess here that my view of caesarean birth has always been, 1, negative, and 2, you've failed in the birthing process. And one of my really good friends who moved back to Australia has since had 2 cesarean births, and even she, when she speaks to me, often, feels probably not the right word is hard done by, but when we spoke about our last pregnancy, she had a planned cesarean, but her first wasn't planned, and I know we're going to talk about that later. And I talked about my second birth and how I was proud to be in the water, and I felt a little bit not very sensitive to her about it, and I felt that her response was very like, oh, I had to have a cesarean birth again, like really negative. But actually it doesn't need to be negative, right? Like, why do we have, okay, so here's a question for you. So Carolyn, why, one, do we have such a negative view of cesarean births? And 2, how can we change people's perception?
Excellent question. One of my favourites. I think a lot of how we perceive cesarean birth comes from the media. It gets portrayed. There's like 2 camps. I tend to find there's 2 camps of people with opinions about cesarean birth. You get the ones that think somebody that's had, especially if they've elected for a cesarean birth, are the too posh to push camp.
Oh, yes.
Which is awful.
Yeah.
Because there's this perception that having a cesarean birth is the easy way out, which if you've had a cesarean birth, you'll know it's not. The recovery is so much longer. People forget, okay, you don't always have the labour part of it, but the recovery can be a lot longer, than a vaginal birth. And then you get the other camp is kind of like what you were talking about, is that they've somehow failed in their duty of becoming a parent and haven't actually given birth.
Yes.
I remember having a conversation with a friend who's had 2 cesareans, and she said, after having my second one of my really good friends said, I feel really sad for you that you've never actually had a birth. And that's just awful to hear. It's And one of the things I always say to clients as well, if you look at the dictionary definition of birth, it is creating new life. There's no mention of how that life starts. So that's why I always try and get people to say cesarean birth rather than cesarean section, because section just sounds horribly clinical anyway, but cesarean birth is just a reminder to everybody, whether you've given birth that way, somebody that's given birth that way, that it is a
birth
and it should still be called a birth.
Yeah Definitely. Absolutely. So how do we, you've already said, it's about, the vocabulary of saying cesarean birth, because it is still the birthing process. Is there anything else you think we can do to, change people's perception? Because even though now I'm educated, I would probably, in all honesty, still be upset if I had to have a cesarean birth. And that's not good, because I'm still birthing a baby.
I know it's a difficult one to get your head around, and I think the more the conversation is had as well, the better it will be, because we tend not to brag about positive cesarean births, because there's still that stigma of, well, it's not really a birth. So when we talk about cesarean births, it's all the negative ones that are being shared, the horror stories and how horrific it was. But there are loads of people out there now starting to have really positive experiences. So the more we talk about them, the more we get those stories out there, the more normal it'll be and the less stigmatized it'll be, I guess. That's one of the things I've been trying to do on my social media, is to have Instagram live chats with people who have had cesarean births. So we've got a whole mix of stories. We have had sort of more negative experiences, but there's some really positive ones in there as well. And I think that's important for people to hear. Otherwise, we're just going to keep thinking that they're not good.
Yeah. There's so much I want to go with that, but I did forget to mention, if you haven't already, listening to this episode, jump on Instagram. Obviously not if you're driving, where I normally listen to my podcast. Jump on Instagram and follow Carolyn at the Caesarean Birth Specialist. She has loads of awesome information, and in fact, her recent post it says, "Wait, there are different categories of cesarean birth." I didn't even know that.
No, not many people do. Most people think the sort of normal terms that you hear outside of being a birth worker are emergency or elective. That's kind of the two choices that people think there are. An elective annoys me a little bit because some people, when they have what's deemed as an elective cesarean, hasn't necessarily been them that have elected to have it. The circumstances have just led that way, which is why I like planned cesarean. It sounds nicer as well.
Yeah.
But yeah, I mean, the 4 categories, you've got category 1 is like, that's the one everybody thinks of when it's an emergency cesarean, like in the hospital dramas, running down the corridor, get out of the way, and like pushing doors open. And so that's your kind of traditional one, which the numbers for that are kind of low, or they're lower. I think for that one, it's the cesarean birth takes place within half an hour of the decision being made. So there is that urgency. Category 2 is still classed as an emergency one, but that's less of a panic. So that's within 75 minutes of the decision being made. And then your category 3, the ones that normally fall into that are people that have had a planned cesarean booked and then have gone into labour early. So it's kind of like a non-planned planned cesarean, if that makes sense. And then your category 4 is your planned cesarean, where you know when it's happening and everything's all calm and slow.
Yeah, got it. See, I didn't even know that. I didn't, there's going to be lots of people that didn't know that, which is amazing to be able to share that. I would also like to say that another post on there that really caught my eye is, how do I know if a cesarean birth is right for me? Because again, I just thought I didn't get to choose that. And if I did, again, my perception is it was negative, right? So can you give us some stats around why maybe some stats around cesarean births, and then why, mums to be would opt for a cesarean birth, and that everybody is totally okay. It's still a birth process, isn't it?
Yeah, definitely. So, I mean, the only statistic I think that's important to share at the moment is, unfortunately, the cesarean birth rate in the UK is much higher than it should be just now. So at the moment, just under 1 in 3 births end up as a cesarean, either planned or unplanned. I've not got the figures to separate them out. A lot of those cesarean births are probably unnecessary. Don't get me wrong, there is a part where you do need to listen to your healthcare providers because they are experienced in this. But I think as people, we're losing that connection with our own intuition and our trust in our own bodies as well. And this is another reason why I want more information out there about cesarean, because if you have more knowledge about the process, what leads to the process of an unplanned cesarean, things that you could maybe do that might minimise your chances of one, then that's going to help lower those statistics as well. I mean, nobody gets pregnant and instantly goes, "Oh, I'm having a cesarean." Everybody thinks of having a vaginal birth when you get pregnant, because that's kind of the natural way, I guess.
But is it okay to want to choose a cesarean birth?
Absolutely, and that's one of the top reasons of a cesarean birth taking place is maternal request. So that can be, usually you'll find if somebody has had a previous traumatic birth, or the other reason it can be maybe they're a sexual abuse survivor and just don't want anything going on down there, which is totally understandable and fine. So you can request to have a cesarean, whether it's your first birth, second, or however many down the line. And within the NICE guidelines, I think I can't remember that exact wording, but you can request a cesarean. And if your obstetrician that you're speaking to and requesting it doesn't feel that you need one, you can then request to change care provider to somebody that is willing to provide it to you, because it is your human right to give birth however you want to.
See, that's amazing. And I bet so many people don't know that.
No, definitely not.
And I'm going off piece a little bit here to what I said we would discuss, only because it's come to mind, and I'm sure it's a really hot topic at the moment, and I'm sure we're going to get some really valuable info from you. But you said 1 in 3 births are Caesarean births, and you have said you think those stats are quite high at the moment. So I'd like to know why you think it's high if actually women can choose a Caesarean, and also that recently here in the UK, there's been a scandal, hasn't there, around an NHS trust that there has been quite a few deaths of babies, quite a few deaths of pregnant mums birthing their babies, and some, really sad stories around babies having disabilities due to, and again, I haven't read it completely. So what I see from the media is that the reason is because they wouldn't do Caesarean births.
Yes. So there's so much to unpick with that.
Oh, I know. I've just opened a can of worms, haven't I?
So this will probably be your longest podcast episode. So first of all, let's just go back to the stats. So 1 in 3 is, when you look at what the World Health Organization recommends as average and be within normal scope, they're recommending, I'm pretty sure, around 1 in 20. So that's quite a big difference. The World Health Organization was obviously monitoring all countries. And then when you look at other countries that are maybe underdeveloped at the moment, they're not having enough Caesarean births. They don't have access to it. So we're trying to meet somewhere in the middle, and that's kind of what the World Health Organization has recommended. I'm sure it's 1 in 20. Now I'm like, was it 1 in 12? I'm pretty sure it's 1 in 20. Double check that. So that's kind of, so their suggestion is that a lot of these Caesarean births that are in that 1 in 3 category are not necessarily needed. And there's a lot that leads to that. Oh, I don't even know where to start. Right. So let's look at it without I'll not mention the Ockenden report and the NHS Trust at the moment, but what we tend to find is that when obstetricians do their training, so this is really important to keep in mind if you're pregnant as well, if you're a parent to be. When obstetricians train, in the UK anyway, I don't know what it's like elsewhere, in the UK, they only train on births that require medical interventions. They never do any training on what's deemed as normality. I'm going to do my inverted commas. In the UK, the midwives are the ones that are to support non-intervention births. So if everybody's low risk and there's no concerns and all fine, it should just be your midwife, you see. So for obstetricians, day in, day out, every month, every year, all they are seeing are the ones that require intervention, and things are sort of going wrong from their perception. So to them, birth is incredibly scary and risky and all sorts go wrong. So it's really difficult for them to step back and pause and assess the big picture. They're trained just to look at measurements, numbers, figures, data, rather than make it an individual experience for each person. Because let's be honest, we're all different. And even if you have 2 births with the same person, they can be wildly different as well. So that kind of, I think, leads to it. And the one of the biggest things I think that can kind of trigger and potentially unnecessary cesarean is the CTG machine when you're on the monitor for monitoring the baby's heartbeat. I think that makes people quite twitchy, for want of another word, because you're just staring at this trace and you're not assessing. So like if somebody's like right at towards the end stages of labour, baby's heart rate will dip a little bit, because I mean, if you were getting squished in a room, all 4 walls on you, your heart rate is going to dip and go up and down. You know, it's kind of normal. But I think we forget that and we get a bit twitchy and a bit anxious to intervene. So I think that has some what's the word I'm looking for? Yeah, it does kind of lead towards that a bit. So this is kind of where doulas come in, is bringing the more holistic side in and balancing it out, because I mean, medicine sort of like the new religion. Everybody is just like the be all and end all. And it's really important to make sure that you have all of the information available to you for making a decision that's right for you, not what's right for your doctor or your midwife or your mum or mum-in-law or whoever. Like, it has to be right for you, and you can't make that decision unless you've got all of that information in front of you.
Yes.
And sometimes, like, I mean, obviously I know a lot of obstetricians and midwives because I did my training, and like I've got a lot of friends that are still midwives, but there are some out there that I've come across when I've been working as a doula that only sort of present half of the information, and I've had to pull it out of them for my clients to be able to make a decision. So that's really key, definitely.
Yeah. And that's exactly what you're all about. And I've talked about in other podcasts around knowledge is power. And that's exactly what you're here to do with the Caesarean Birth Specialist, is to give as much knowledge around Caesarean births as you can. And like we've said, you know, it's really important that we change our perception around Caesarean births, and whether it's a choice or whether it's, you know, unplanned, you are here to make it the most positive experience possible for everybody, right?
Yeah, absolutely. You know, I want everyone to come away feeling positive and empowered and proud of what they've done.
Yeah. And I'm just going to do a quick note on what you were talking about with, you know, medical eyes and having a more holistic view. When I was in hospital with Evie, my second little girl, she was in there with jaundice. And I've said this many times before, but actually I haven't shared that on the day before we were ready to go, we had a couple of false starts. We were ready to go, and then she lost too much weight. Then we had to stay on again, and then her jaundice levels were, you know, it was just this up and down of, am I ever getting out of here? All about me, but you know. But one of the doctors, and she was a doctor, pediatric doctor. She wasn't a midwife, and she actually said to me, "Marnie, I'm not going to weigh Evie, because if I do, she will fall in a category that will make her need to stay in." She said, "I am happy with her progress, and I'm happy with her jaundice levels enough to send you home, because I know you've got the tools and you're going to be less stressed. You're going to be producing more milk. You know how to top her up. You're all ready to go home and care for her now that her jaundice levels are down. If I weigh her right now, I will need to keep her in again." And that there, and I just started bawling my eyes out. I was like, thank you so much. Because if that happened to be another doctor who didn't take into consideration where both Evie and I were in the process, and just said, part of what I need to do is to weigh her right now before I release her, they would have done it. And we would have been spending another 48 hours in there. And, you know, it would have been horrible for both of us. So that is a pure example of why, you know, exactly like you said, having a more holistic approach, having knowledge, you know, and doulas absolutely do that. I just interviewed for our second series a doula yesterday, and it was the most amazing chat ever. And I didn't know you can have a sibling doula. Yeah, I was like, I needed one of them for my daughter, a doula who looked after, you know, to look after the transition from and even for me, the transition of having one child to two, and then helping my firstborn deal with having a second baby in the mix, right? Anyway, a little bit off topic. Sorry, everybody. So let's get back on topic. We've talked about the negative perception and how we need to talk about Caesarean births and the fact that they can absolutely 100% be positive. And we know the first step to that is knowledge, right?
Yeah, absolutely.
So you have an amazing course called How to Prepare for a Caesarean Birth.
Yeah.
And you're going to give us a sneak little peek into, you're going to share 3 quick tips related to that workshop. It's not a course, it's a workshop, everybody. Sorry. A workshop. You're going to give us 3 quick tips of bits that are in that workshop if anyone wants to check it out. And I'll put it in the show notes as well. So educate us.
Okay, so one of the things that people find when they have a cesarean, especially if it's unplanned, is that it suddenly feels like it's not personal, everything's happening to you and you've no control over it. So to take that away, there's a lot of things you can do when you're in the operating theatre to make it more personal, make it more positive. So the top 3 things that I have. There's many, but these are my favourite ones. You can have your own music playing in theatre. I've had clients that have had their first song that they danced to at their wedding, or something really meaningful. I've had all sorts played, but yeah, just whatever makes you feel calm or happy or loved. Get that oxytocin flowing. That's always good. So that's a nice easy one. One thing that people don't know is you can still have optimal cord clamping as well. People think that the cord needs cut right away. It does depend on why you're having a cesarean in the first place, but research now shows that the longer you leave the cord unclamped and uncut, the better it is for baby, because they're getting more of their blood supply before the placenta's disconnected. So that's a good one to know. And then my favourite one is, if you want to see your baby being born, you can ask for the drapes to be lowered. So you can watch your baby coming out, and sometimes you can even lift your own baby out as well if you want to plan that ahead.
Wow.
A kind of wee extra one there. Sorry, I couldn't resist.
I love it. Four of them.
4 top tips.
If you are planning, or you know that you could potentially be recommended to have a cesarean birth, I 100% recommend that you check out Carolyn's How to Prepare for a Caesarean Birth workshop. But also, we spoke about this. What if my audience is a little bit like me and literally want to know everything about everything, and in particular about all eventualities that could happen during the birthing process, and go, actually, I think I would be able to handle my birthing process much better if I knew about everything. And part of that is actually knowing, about a cesarean birth. What information could you give us?
Yeah, so that's at the moment I'm working on separating things out of my course into more bite-sized chunks. But one of the things we cover in the full course, and that I'm going to do as a separate standalone thing, is exactly what to expect from a cesarean birth. So from the moment the decision has been made, whether that's planned or emergency, is what the process will be, who'll be in the room with you, who you'll talk to, what will happen. And it just, if everybody did that, regardless of whether they were planning a cesarean or not, it kind of just takes that unknown element out of it. And as you say, especially if you're somebody that likes to know all the details and all the information, it just gives you that sense of calm, because it's not scary and unknown anymore.
And yeah, for me, my games athlete brain, we talk a lot about control the controllables. And in a game, you can only control what we do as an athlete. We can't control what our next teammate does, really, or what the opposition does, or what the referee or umpire does. We can't control that. And I bring that a lot to my second birthing experiences. What can I control? And actually, what I can control is my knowledge. My knowledge around everything, and how I want to experience it, and be able to put a positive spin on everything. And if and this is, a bit of a pep talk to myself, maybe for my next pregnancy, if it ever does happen, or for people listening, is, knowledge is power, but also, knowing in your head that you do want a positive experience, and learning and coming to terms with what you can spin into a positive, if that makes sense.
Yeah, definitely. And I was going to say, one thing that's really beneficial, and quite a lot of people still don't know, is you can still use hypnobirthing for cesarean births as well. And actually, controversial, it's probably even more beneficial for a cesarean, because it lets you ground yourself, focus on what you're doing, your mindset. When everything sort of can feel like it's spinning a bit out of control, it just gives you that, okay, this is my center of calm, this is what I'm doing, and it's fine. And yeah, like you say, a lot of it comes down to mindset, definitely.
Yeah. I have had 2 hypnobirthing specialists on the podcast. One was my own, Kez, which was amazing. We talked about the science behind hypnobirthing, which I love. And then the other was Birth Plan. It was from the Baby and Birth Company, and it was Claire. And we talked a little bit about, planning for I don't know if it was planning for cesarean, but just that you can use hypnobirthing tools, right?
Yeah.
And I do remember slightly covering it in the hypnobirthing course, but actually, I think definitely could go much deeper.
Yeah, there are now a lot of the hypnobirthing providers are doing like a separate standalone cesarean one as well, especially if you already know you're having a cesarean, to sit through a full hypnobirthing course for people that are having a vaginal birth. You don't need to be there for a lot of that education part, because you're like, well, it's not relevant to me. So a lot of providers are now starting to do a separate course, and a lot of their scripts are more specific to that situation as well, which is good.
Yeah, but yeah, definitely your new mini course on preparing or I can't remember exactly what to expect.
Yes.
In a cesarean birth. There we go. What to expect. I think it's knowledgeable for everybody. If you are pregnant, I think that you should definitely educate yourself around a cesarean birth, because you don't know what's going to happen, and we still want all our birthing to be as positive as possible.
Yeah, exactly. And as I mentioned earlier, if you have that information and you're keen to avoid a cesarean birth, you know the things to look out for, the little kind of markers down the path for which route to choose to minimise your chances of that happening.
Yeah.
So again, that knowledge is useful if you're wanting to avoid one as well. So it's really important.
Yeah. And actually, thinking about avoiding, I forgot to ask earlier in the conversation about, I know one of the most common questions that you get from clients reaching out, or potential clients reaching out, or people reaching out to you on Insta, is around, they had an emergency cesarean birth the first time, and now they're not quite sure what they want to do second time around.
Yeah, there's this big dilemma. And actually, one of my close doula friends is a VBAC specialist as well. So it's quite good. Our work ties in quite well together. But I'm
just going to interrupt you there actually and say, do you know, I didn't even know what VBAC was until within a year ago, must have been just over a year, where one of my really good friends who also plays international sport with me, she'd had her second boy, and she started talking about the fact that she'd had a VBAC and it was the worst decision ever. And I'm like, what's a VBAC? I honestly didn't even know.
Well, that's the thing. If you've not had a cesarean, it's not on your radar. It's not relevant. So a VBAC is a vaginal birth after cesarean. Sometimes you can hear it called an HBAC, which is a home birth after cesarean. So that term gets branded around quite a lot within sort of the cesarean birth field. But yeah, it's a prime example with your friends there. It's really interesting you said that, because the dilemma a lot of people have after having a cesarean for their first is whether, because you automatically get the option of having an elective or a planned cesarean for your next birth, or going down the VBAC route, the vaginal birth. And a lot of people find it really difficult to make that decision, because there's that need, that want, and that desire to experience a vaginal birth because they've not experienced it. And going back to what we talked about earlier, it's that sense of failure if you don't experience that, which again, let's to reiterate, it's not necessary. You've not failed. So there's that kind of want to try it, but not wanting the experience of things turning into an emergency cesarean again. Whereas the option of a planned cesarean can feel quite comforting for a lot of people, because it's within their control a bit more. They can plan, they've got time to get their head around it, it's calmer. The recovery is usually better after a planned cesarean because you've not gone through a long labour beforehand. So there's pros and cons to both. And a lot of people come and ask what they think I think they should do. And I can't answer that because everybody's different. So what works for one person isn't necessarily going to work for another. And it's important to say as well, like if you opt for a VBAC and during the process you suddenly feel, actually, do you know what, I don't think this is working, or I'm not happy with this anymore, you can change. You're not like held to that one path. No, you chose a VBAC, you must have a VBAC now. It's, I've known some people have said, right, well, I'll go for it. And if a labour kind of within by this amount of time, and if I've not given birth by then, I'll probably request a caesarean. And again, people don't know they've got that option to choose or to push. So it's
about setting the mindset for that as well. Or, you know, rather than if you're my personality, you're very stubborn. Like, no, I said I was going to do this, so I'm going to do it. But actually, it's not the best. It's probably not the best for you or your baby.
Yeah, exactly. And again, it goes back to that listening and tuning in with yourself and trusting your instincts, and not listening to your mum or your mum-in-law or whoever else is influencing you, and like hone in on what you want, what's important to you, and what's going to make you feel good. Yeah.
And I think I remember seeing something on your Instagram about intuition as well.
Yeah, definitely.
I love it. So if you don't follow Carolyn already, she's at the Caesarean Birth Specialist on Insta. It is a fantastic account, so valuable. Cool. Okay. Besides brain overload with the amount of expert advice we've got, which has been amazing, I would love to finish with 2 questions, if that's okay. Okay. What's the one thing that a mum-to-be is going to unlikely know about a caesarean birth?
So one of the things that tends to catch most people out is when you give birth by caesarean, you still get the postnatal vaginal bleeding. A lot of people don't anticipate that because it's not been discussed and nobody really talks about it. So you will still have that postnatal bleeding, unfortunately. You still get that delight as well.
Why is that?
So the bleeding that you have when you give birth, when your placenta detaches from the inside of your uterus, it does leave, well, essentially it does leave a wound. That's an open wound. So the bleeding you get from that is just your uterus shrinking back down, repairing itself, and flushing out everything that's no longer needed.
Very good. Didn't know that even with my vaginal birth. Thank you. Okay, and then I know you're super passionate about, we talked about your mission on making sure that caesarean births are positive experience for everybody. So what's your one favourite thing about doing what you do?
It's definitely just the hearing back from people. Like if I'm working with somebody directly, or if I've messaged somebody or shared posts on Instagram, I sometimes get messages from people as well, which is really nice, is when they come back and go, I just want to say thank you so much for the information. I had the most positive caesarean I've ever had. It was incredible. I felt amazing. I felt so powerful. And that just makes my heart sing when I get messages like that. It's really good.
I love that because just like you said at the beginning, definition of birth is bringing life. It's not about how it's done.
Yeah.
And that's just amazing. It's amazing for those women as well.
It is. And it's nice to know that, like, through the little courses that I'm doing, I'm obviously starting to reach more people. And then if they've had a positive experience, then they're going to talk about that. And then the people in their life that are giving birth and have caesarean, they'll have a positive story to go on. So it'll be like a nice ripple effect.
Absolutely. And sharing it, which is great. We have to normalize it way more, don't we?
Absolutely.
Yeah, I love that. Talking about sharing it, for everybody listening, I am going to pop Carolyn's details in the show notes, link to her how to prepare for a caesarean birth, and her link to her mini workshop, what to expect in a caesarean birth. Carolyn, it's been amazing chatting to you. Such valuable content. Thank you so much.
You're welcome. I've had a wonderful time. I could talk about it all day. I'm surprised you've managed to cap me so well.
I'm quite surprised, actually, because, we could talk about it, but I feel like we just kept to the point for everybody listening. And, the most important thing was to educate, motivate and inspire. And hopefully we've done that. And listeners, if we have subscribed to our podcast, do drop us a message on Insta. We'd love to know how valuable you felt the episode was. And I'll catch you in the next episode. Thank you for listening to another episode of the SportsFit Mums podcast. It's awesome to have you along. If you would like to join our community, follow us on at SportsFit Mums on Instagram. Alternatively, do check out the subscription notes, as you will see a
a link to our Ultimate Fitness in Pregnancy mini guide. From here, you'll also get some details of the up and coming release of the new Strength